We're back with Cone Health's Dr. Cynthia Snider. This person's asking, how long can you expect to be immune after getting COVID?
It really depends on the individual. We think that you probably have some protection for a good minimum of 3 months. However, sometimes we are seeing people that may have been infected with Delta, come October, November, and they have a mild case of Omicron now. So if you've had COVID before, it doesn't make you completely immune. You still are at risk of getting Omicron right now.
Yeah, because that's a follow-up question that we had. Have you heard of many people getting COVID twice?
We have. We have had folks that, and so it's a little bit of a tricky question because some people didn't get a chance to get a booster after having a natural infection, a natural immunity, and knowing that getting another dose of like one of the mRNA vaccines really boosts your immunity and protects you against Omicron variant.
Well, speaking of the booster and things, someone's asking, will I need to get a 4th shot?
There is data, especially from Israel. They were one of the first countries to really launch a 4th dose out to their population, and it suggests that it does give you added immunity over time. So I would not be surprised if we needed another 4th dose in the coming months.
This person's asking, when might the treatments like the COVID pill become available to the public?
That is a great question. We, I think, around the nation, a lot of health systems are waiting to hear more about mass production and mass release of the antiviral medications as well as the monoclonal antibodies. I think that's what's one of the reasons why we're also seeing a huge impact in our hospitals, not only by the sheer amount of cases, but in the past we had, treatments on the outpatient side that could prevent people from getting hospitalized. But right now, due to the shortage of monoclonals, as well as very limited supplies of the oral antivirals, that has complicated our scenario much more than it has in the past.
This person's asking, is it normal for me to keep testing positive after my 10 days are up?
So there are 2 types of tests. The PCR test can be positive for many months, like up to 9 months, up to 90 days after having your initial infection. But the antigen test should not be positive after
That's the rapid test. That rapid test, the one that you can do at home, that one should not be positive after 10 days. But the PCR test, the one that goes off to the lab, can possibly be positive for a while. And the difference is what? The rapid test shows the level of infection?
The threshold is just a bit higher than PCR. So it will be positive for, we anticipate, like 7 to 8 days. That's why the test kits shouldn't be used on people that have symptoms later than 7 days. It's definitely sensitive if you have new onset of symptoms within 7 days, but it really, that's why we don't recommend folks to do the PCR testing as for clearance, after that 5 days of isolation, because there's a good chance that's definitely going to be positive still.
Is that just because there's just virus somewhere in your body, but you are not infectious?
It is. It doesn't necessarily, most of those PCR tests are not going to be like a quantitative value to tell you, this number tells you you're infectious and this other number tells you it's not. It's a very sensitive test. So we often see those tests being positive if you've recovered from COVID, even like a month out or 2 months out.
Okay, so if you're getting a test to clearance to go back to work, get the rapid test, get the at-home test.
Correct.
Got it. Okay. Thank you so much for answering our questions. They continue on and on and on, and we so appreciate it, you answering them. If you missed any of this, what we want you to do is be able to go back and find it on our website so that you can listen to it again, get your question answered. It's in the 2 Wants to Know section.